Health checkups are generally considered a smart strategy for managing well-being. But did you know that some screening tests may carry potential risks for certain age groups? This is especially true for older adults. Leading medical bodies like the U.S. Preventive Services Task Force caution that not every screening test offers the same benefits across all age ranges. Some tests may lead to false positives, unnecessary anxiety, or even inappropriate treatment plans. For individuals aged 70 and over, the balance between benefit and risk must be evaluated more carefully. In this video, we'll take an evidence-based look at 5 health screenings that should be approached with caution in older adults. We'll explain why some tests are less commonly recommended, discuss potential risks, and highlight the importance of personalized decision-making. Our goal is to support your health literacy and help you make informed choices. Remember, every individual's health needs are unique. That's why it's essential to consult with your own doctor before making any changes to your testing or treatment plans. Ready to take a closer look? Let's begin. Number 1. The colonoscopy dilemma. Colonoscopy has long been considered the gold standard for colorectal cancer screening. However, after the age of 70, especially for individuals without symptoms or a family history of colorectal cancer, the potential benefits of routine colonoscopy may decrease, while the risks can increase. Medical organizations such as the American Geriatric Society and the U.S. Preventive Services Task Force recommend that after age 75, decisions about colorectal cancer screening should be made on an individual basis. This is because the progression of colorectal cancer, which typically takes 10 to 15 years, may not align with the life expectancy of older adults. Colonoscopy is not a minor procedure. It requires bowel preparation, which can lead to significant fluid loss and electrolyte imbalances. In older adults, this may increase the risk of low blood pressure, fatigue, and falls. Sedatives used during the procedure may also remain in the body longer, potentially contributing to post-procedure confusion, dizziness, or temporary cognitive decline. Another important consideration is the risk of overdiagnosis and overtreatment. Many small, slow-growing polyps found during colonoscopy are unlikely to become cancerous during an older adult's remaining lifetime. However, their detection can lead to additional procedures such as biopsies, repeat colonoscopies, or even surgery, which carry their own risks. The American Gastroenterological Association emphasizes the need for careful evaluation before performing new colonoscopies in adults over 75 who have a history of negative screenings. As an alternative, non-invasive stool-based tests such as the fecal immunochemical test or the multi-target stool DNA test are now widely available and may offer effective and safer options for colorectal cancer screening, particularly for asymptomatic individuals with lower risk profiles. Ultimately, in later life, good health care is not always about doing more tests, but about making more informed choices. Screening decisions should be personalized, taking into account each individual's physical condition, emotional well-being, and resource availability. Number 2, the PSA test debate. Finding the right balance in prostate cancer screening. Prostate cancer is relatively common among older men. As a result, the prostate-specific antigen, or PSA test, has become a routine screening tool for many. However, for men over the age of 70, the potential benefits of PSA testing are less clear, while the risks associated with it may be more significant. The PSA test measures the level of a protein in the blood that may be associated with prostate changes. Although elevated PSA levels can suggest the possibility of prostate cancer, they are non-cancer specific and may lead to false positive results. Studies indicate that in men over 70, even minor elevations in PSA levels can result in unnecessary biopsies, anxiety, and sometimes treatments that may not have been needed. It's also important to note that many prostate cancers detected through PSA testing are slow-growing and may never cause symptoms or affect a man's health during his lifetime. Despite this, some individuals may undergo aggressive treatments such as surgery, radiation, or hormone therapy, which carry potential long-term side effects, including urinary incontinence and sexual dysfunction. For example, a 75-year-old man diagnosed with a low-risk form of prostate cancer may be offered surgery. However, an approach like active surveillance, which involves close monitoring without immediate treatment, may help preserve quality of life while still offering effective management in select cases. Health authorities such as the American Urological Association and the U.S. Preventive Services Task Force generally do not recommend routine PSA screening for men over 70. Instead, screening decisions should be individualized, taking into account a person's overall health, life expectancy, and personal values. In summary, when it comes to PSA testing in older men, making an informed decision is crucial. While the test may provide important information in certain cases, it can also lead to a cascade of medical interventions that may not improve outcomes. That's why any decision to undergo PSA testing should be made in close consultation with a healthcare provider, using a careful risk-benefit discussion tailored to the individual. Number 3. The whole body scan dilemma, when more screening may not mean better health. The idea of a whole body scan can sound incredibly appealing. An advanced imaging machine that checks your body from head to toe, potentially uncovering diseases before they cause symptoms. It may seem like a smart precaution, but for adults over the age of 70, this approach can sometimes do more harm than good. Imaging technologies such as computed tomography and magnetic resonance imaging are capable of detecting even the smallest variations in the body. While this sensitivity can be useful in certain clinical settings, it often reveals what are known as incidental findings, unrelated abnormalities that are unlikely to cause harm during a person's lifetime. These findings may include small nodules or shadows, which are typically benign and clinically insignificant. However, once detected, they can trigger a cascade of additional tests, including biopsies or even surgeries, that may not be medically necessary. This chain reaction can disrupt the process of healthy aging. A 2013 systematic review published in Archives of Internal Medicine found that incidental findings were surprisingly common, with up to 30% of abdominal computed tomography scans revealing unexpected anomalies that had unclear significance. Furthermore, a 2018 analysis in the BMJ highlighted that many of these findings often led to unnecessary medical interventions, contributing to psychological stress, physical complications, and financial burdens for patients. In older adults, these concerns become even more critical. As the body's resilience declines with age, recovery from procedures such as biopsies can be slower and more complex. Complications like infections, bleeding, or prolonged hospitalization may follow what was originally meant to be a precautionary measure. Imaging sessions themselves can also increase anxiety and physical discomfort, especially for those with mobility limitations. There is also the emotional toll to consider, one that is often overlooked. Rather than enjoying their current health, some older adults may find themselves preoccupied with what might go wrong, impacting overall quality of life. Whole-body scans are typically not covered by insurance, and many people pay out of pocket, believing they're purchasing peace of mind. But in reality, they may be stepping into a cycle of overdiagnosis and overtreatment without realizing it. At this stage of life, responsible health decisions may look different. Listening to your body, not just machines. Focusing on actual symptoms, not shadows. Understanding that not every variation in imaging poses a threat. More screening does not always mean better health outcomes. Sometimes less is more, especially when it preserves peace of mind, physical well-being, and overall life satisfaction. Number 4. Rethinking cardiac stress tests in older adults. For decades, the treadmill stress test has been one of the most commonly used tools for detecting potential heart problems. However, in individuals over the age of 70, the clinical benefit of this test may diminish, while the risk of unnecessary procedures increases. One key reason is the likelihood of false positive results in older adults. As people age, arteries naturally become stiffer, blood pressure may fluctuate more significantly, and electrical conduction in the heart can change. While these are typically normal age-related changes, a stress test may misinterpret them as signs of disease. This can lead to a cascade of follow-up interventions, including angiograms, cardiac catheterizations, or even stent placements. These procedures are not without risks, especially in older adults who may experience complications such as bleeding, acute kidney injury, episodes of low blood pressure, infection, prolonged hospitalization. A 2014 study published in JAMA Internal Medicine found that stress tests in asymptomatic older adults did not lead to better clinical outcomes and were often associated with unnecessary invasive procedures. Additionally, both the American College of Cardiology and the Choosing Wisely initiative have issued strong recommendations against the routine use of cardiac stress testing in individuals without symptoms. The key takeaway from the research is clear. For older adults who are not experiencing symptoms, routine stress testing is unlikely to extend lifespan and may actually reduce quality of life due to the potential for overtreatment. Instead of focusing on complex diagnostic tests, the most effective way to support heart health in later years may be to prioritize foundational lifestyle practices: daily walking, balanced nutrition, staying socially connected, managing sleep and stress. Your heart communicates in more ways than test results. Listening carefully to your body and how you feel can often be more insightful than relying solely on machines. After age 70, optimal healthcare often means focusing on meaningful risks rather than reacting to every possibility. Number 5. The silent risk: invasive cardiac testing in asymptomatic older adults. The concern that heart disease may emerge suddenly often drives more aggressive cardiac screening in older adults. However, in individuals without symptoms, routine advanced imaging and interventional procedures performed primarily due to age may offer limited clinical benefit while increasing the potential for harm. Procedures such as angiography, stent placement, or even bypass surgery, often triggered by findings from non-invasive stress tests, are now being more critically evaluated in asymptomatic elderly populations. Research suggests that these interventions do not significantly reduce mortality or heart attack risk in this group, and may instead lead to higher rates of complications. A 2012 study reported that stress tests performed in asymptomatic adults over the age of 70 yielded false positive results in up to 50% of the cases, often leading to unnecessary angiography and interventions. A 2019 analysis further indicated that routine cardiac screening in older adults without symptoms did not improve life expectancy, but was associated with increased risk of non-cardiac complications. Possible risks of these procedures include bleeding at catheter entry sites, internal bleeding due to anticoagulant use, kidney dysfunction, especially after contrast use, infections, delayed physical recovery. Moreover, long-term medications following cardiac interventions, such as blood thinners, may increase the risk of falls or head trauma in older adults. What to consider? If an individual does not experience symptoms such as chest pain, shortness of breath with exertion, or fatigue, the risk-benefit balance of advanced cardiac testing should be carefully assessed. Organizations such as the American College of Cardiology and the American Geriatric Society recommend avoiding unnecessary cardiac interventions in asymptomatic older adults. One of the core principles of healthy aging is minimizing exposure to non-essential medical procedures. For many, the most effective and safest approach to maintaining heart health involves staying physically active, following a balanced diet, attending regular checkups with a healthcare provider. In many cases, lifestyle choices and close monitoring may be more beneficial than invasive procedures. especially when there are no warning signs or symptoms to guide intervention. Aging is not a weakness, it's an opportunity for greater awareness. It's no longer just about getting more tests, but about asking which ones are truly necessary. Despite advances in science, many medical routines still emphasize preventive testing without always considering the evolving risks that come with age. Yet the evidence is clear. For adults over 70, some screening tests may not extend lifespan and, in some cases, may reduce quality of life. False positives, unnecessary procedures, complications, and emotional stress are real concerns that shouldn't be underestimated. At this stage of life, healthcare should become less about checklists and more about personal dialogue. How do you feel in your body right now? Will the risk of a test truly offer meaningful benefit? Will the results change your health decisions? Or are they based on habit? Being informed doesn't mean accepting every recommendation. It means asking, is this the right choice for me? Declining a test isn't neglecting your health. It can be a way to protect your well-being and peace of mind. Remember, health is not just about screening for disease. If you don't have symptoms, sometimes it's more valuable to listen to your body than to rely solely on tests. In later life, healthcare is best guided not just by prevention, but by thoughtful, personalized decisions. If today's video gave you something to think about, you've already taken the first step. Remember, the information in this video is for educational purposes only and is not a substitute for professional medical advice. Before making any changes to your healthcare plan, always discuss your personal health situation and the topics covered today with your trusted healthcare provider. We'd love to hear from you in the comments. What did you learn, and how might it shape your approach to health? If this video was helpful, please like, subscribe, and share it with others. Your support helps us reach more people with thoughtful, balanced information. Thank you for watching. Manage your health with knowledge and live life on your own terms. We'll see you in the next video.